there should have a, there you go.
Are we live?
You're
Okay.
live.
Hi, everybody out there on social media. I'm really excited to be here. This is the first time that we are going live on YouTube and Facebook, and we got TikTok running here on my phone. And those of you on TikTok, you can go on Facebook or YouTube, Dr.B Addiction Recovery. So that's exciting. Two, we are so fortunate that we have Parham Namatola. In Orange County, I find him to be the supreme master therapist in substance abuse. He runs his own substance abuse treatment center. He is well known in the county. I am fortunate enough to know this young man and be affiliated with him. And me and him used to have a live thing going on every week. And we're both back here today. He's made some time for us, and we're going to answer all your questions. We're going to be exactly 1 hour because of time constraints, and it's all about anxiety wherever this takes us. So excited to be here. Parham, I love seeing you, man. I'm so, you know what? We don't get to hang out, right? Patients always come in from all over the country. I've had patients come in, ask about you, and they're like, hey, where can I find Parham? And I know you're really busy. I don't think you take private clients. Maybe you do. I don't know. But it always makes me think, and I'm so glad to get together with you today.
Oh man, Dr. B, honestly, those few, I think the whole year that we did a weekly show together was one of my favorite things to do. And maybe this can trigger the start of maybe a different version of that, but I'm always grateful and happy to have the opportunity to come on with you. I don't really do these too often, to be honest with you. The reason I do it with you is because of who you are and how much trust I have for your professionalism and your expertise in the space of healing, transformation, recovery, addiction, and everything in between, man. So just so everyone knows, I'll give a little introduction about myself, but this is interactive. So I don't want it to just be me and Dr. B. As you guys can tell, I could put up anybody's questions like, good morning, what's up, everyone? I have all this information here I could put up. So if you have any questions you would like to ask us, please ask, and we'll gladly put it on. If anybody wants to jump on and talk to us, you can. So a few things about myself, and we'll go from there. Is my name is Parham. I have a master's degree in marriage and family therapy with an emphasis in child development. I am a licensed advanced alcohol and drug counselor. I also, coach high school basketball. And Dr. B, you don't know this, I'm officially a faculty member at Saddleback Community College. I teach in the Human Services Department now.
Awesome! You beat me. You beat me to that thing. It's one of my dreams of when I retired to teach. That's exciting.
So,
I've been a teacher all my life, so I love that kind of thing.
Yeah, so I'm really excited about that. And today we're talking about all things anxiety. So I see on the chat on the side, we have a lot of individuals talking about various benzodiazepines and wanting to know more about how to get off benzos and all that kind of stuff. And today I kind of want to take my opportunity in the first few minutes to frame at least what I think anxiety disorders, what the roots and the origins of them are, and hopefully assist people in differentiating between circumstantial and situational anxiety and an anxiety that sometimes we're often too familiar with at a very, very young age, that in the beginning, we don't have the words to express what it is that we're feeling. So I believe that anxiety disorders come from our attachments. Okay. And this is, I'm pretty grounded and rooted in this orientation, this belief. So all of us as human beings, we have these attachments. They usually start off to these things called primary caregivers, right? We can call them mom, we can call them dad. Some of us can call it grandparents, we could call it adopted parents. Sometimes we can only call it mom, or we can only call it dad, right? And the stronger we have these attachments, the safer we feel within our attachments at a young age, the more safe we feel in this world that is highly complex and always evolving. And we're able to kind of self-regulate our emotions because the environment allows us to be able to feel safe in that environment. Now, if you come from a home that was very chaotic at a young age, if you come from a home that there was a lot of fighting and yelling at a young age, if you come from a home that maybe there was only one primary caregiver and the other one was nowhere to be seen, all of a sudden the roots of anxiety and the foundation of anxiety starts to formulate and starts to get created. What that means is, looks like something as subtle as this. Let's say you don't have a dad in your life and you only have your mom, and you're out at school waiting for your mom to come pick you up when you're 7 years old. And all of a sudden, 5 minutes goes by, 10 minutes goes by, 15 minutes goes by, and mom isn't there yet. Now, she could just be running late. But in the mind of that child, all of a sudden they feel, what happened to my mom? Is my mom alive? Am I going to see my mom again? Am I stranded? Am I lonely? Am I going to die by myself in this life? And I'm telling you, the mind of the child goes there. And that's the first like flavor of anxiety that people start to experience. Later on, our attachments start to progress to social groups, right? You know how many adolescents struggle with social anxiety because their attachments to their peers are shaky and they're rocky and they're unable to kind of be their full expression because their attachments are weak. Later on, it turns into relationships, like romantic relationships. They become our attachments. And when something is rocky in that, we start to sense anxiety. And most people that get, diagnosed with anxiety disorders, usually in adolescence, something's up. They go to the doctor and they say something's not right. They're not feeling right. They're not doing good in school. They can't focus. They're always anxious. They can't sleep at night. And enter the Western world of medication management in terms of for symptomology instead of going to the root cause of it. And most people on your channel, we've done a few videos on benzos, Doc, together, and it was very, very well received. My heart goes out to all those individuals because at some point in their life, because of their attachments and their anxiety and all that kind of stuff, they got put on medications without ever addressing the root cause or where it's coming from. And later on, that turns into a serious benzodiazepine addiction, which a lot of people on your channel are struggling with trying to get off of these medications. And so that's where I stand, Doc. I'm actually curious to know your thoughts on the attachment theory when it comes to the weakness of attachments leading to possibly anxiety disorder. So I think that's a great place for us to start. And maybe we can have some people kind of feed in and share back their experience.
So 2 points real quick. One, I'm delighted of what you said. In fact, shocked and surprised, because that's the only place I go with this issue. Two, so many things are kind of, it's awakened a salad in my brain because I'm like, man, we need about 4 hours for this because we have to start from the developmental stage and eventually get all the way up even to social particular phobias, right? And connect all of it together. We don't have the time. But let me address something you brought about and exciting. I'm going to add to Parham. I 1000% agree with Parham. I'm going to add a little bit of formalization to it. And I want to bring up something. And Parham knows I've spoken to him. For those of you that know, I am an MD, medical doctor. I specialize in substance abuse, historic emergency medicine. But I'm well immersed in certain psychoanalytic traditions throughout my years. And the one I really, really embrace for this kind of stuff is objects relations. Doesn't matter. Objects just means everything Parham said, the father figure, the mother figure, the significant figure. Parham, what you described is so absolutely captures it. And I would say this starts so far earlier in development than people realize. And it's really, and the place where it really, we can divide the lines where it declares itself is separation, individuation. Ages, I don't know, 2.5, 2, 4. It is critical so that it's done right. And as Winnicott once said, you just have to be a good enough mother, right, for this not to go down the tubes. And it doesn't have to be mother, that's an object, right? Yeah. Separation, individuation. That baby, that small child doesn't understand. And here's how I look at it and how I relate it to substance abuse. As early on, they can't. And again, whether this is absolutely true or not is not important what it means epistemologically, ontologically. It's important that the construction of what I'm describing works to give us answers and help us with predictions. So coming up to that time, 2.5, 3 years old, that child doesn't realize that it's a separate individual being in the world in some ways. And that separation and individuation for that child at that stage is cataclysmic. It's frightening. They have to be heroic to take that step out. They have to actually really exercise truly trait narcissism to have such a grand ego to take that step out over the fire, lake of fire. And they do most of the time. The parental role, the object role, the people around them role have to make that a soft landing and hold their hand, B, at the same time, push them towards that healthy. That event is anxiety producing in a natural way. And from there, as things go wrong with all of the negative, bad stuff that Parham was describing as you're coming up, that's what one thing, what's important to my point here is when you get into those teenage years and they start to have that social anxiety, trying to get acceptance, I have to say, and I think Parham agrees, this is a contiguous chain of events steeped in the narrative and personal history of the individual that has to go right during these years. Okay. And in fact, this is how personality disorders also blossom. Okay. This is how anxiety disorders blossom. This is how depression blossoms. And if you wonder how ACEs, adverse childhood events, causes a lot of bad stuff later in life, whether it's immunological, whether it's pulmonary, whether it's legal, well, it's normal to have an episode of anxiety. It's normal to have an episode of fear. The norepinephrine fires off, the cortisol fires off, everything fires off. What's abnormal is if these things are firing relentlessly, pathologically during this developmental stage that Parham described, and now you have pathological disease states and oftentimes misdiagnosed, mistreated. And the World Health Organization is very clear. We can treat this crap for pennies on the dollar early on. We don't. It's a huge source of morbidity, mortality, disease, death, huge cost to economies. And it just is a ripple effect that destroys everybody around us. And I'll stop there. I'll let Parham go because I want really Parham.
Oh man, that was my favorite thing about you, Dr. B, was how you take something and conceptualize it and just expand on it. So I'm going to expand on something you said even one step before that, just to play off each other a little bit. So for everyone kind of listening right now, we're talking about the human development stages across the lifespan. It's not just childhood, it's across the lifespan because we're constantly evolving. And Doc talked about a really sensitive time there, 2.5 years old, this and that. I'm going to take this one step further from something that I learned in textbooks about a certain time in world history, but it's something that I personally also experienced as a human being. And I'm going to tell you guys this. Human development doesn't just start from the time we're born, my friends. Human development starts from the time that we are inside the stomach, the natal, whatever you want to call it, of the mother. There is a lot of research and studies that shows the higher stress levels the mom had during child pregnancy, because it relates to cortisol level, adrenal levels, all that kind of adrenal glands. The child can actually be born with levels of anxiety because of the stressed pregnancy period. Now, the first time they kind of came in realization to this was back around World War II. There was a lot of small infant Jewish babies that were crying all the time. I mean, I'm talking about they couldn't get these kids to cry. The family members are calling the doctors and say, we can't get our kid to stop crying. We don't know what's going on. We don't know what's going on. Well, check it out. For 9 months of development of that child inside the mom's stomach, what type of a world was that mom living in? What type of stress was she exposed to? What type of chaos, of fear was that child exposed to? And how does that impact the child? And then when the child's born, it has symptoms of anxiety before it even knows anything about life. Where did that come from? Right. And in our world, I mean, me and Dr. B come from the same background from the country of Iran. And when I was born, when I was kind of in my mom's womb, when I was a young child, we were going through this war called the Iran and Iraq War. And what that war looked like was we'd be inside the house, sirens would go off, and the family would have to go to the basement to protect itself from potential missiles bombing of the city. Now, do you think that has an impact on the child? Do you think that has an impact on the development of the child? Absolutely. So these stressors, they're not just from the time, you're growing up and mom and dad are fighting, or you're in school and you have a little social anxiety because maybe you keep moving and moving and going to different schools, it goes from then and there. From the time that where life is conceived, it continues on. So I just wanted to add that in there because sometimes people don't correlate. I mean, there's stuff, I mean, you're a medical doctor and you probably know this better than me. There is studies that show that children that are born with asthma, the reason why they're asthmatic when they're born sometimes relates to the stress that they were under when the stress the mom was under during the pregnancy period.
Yeah. So that's I'm glad you, I thought I was trying to get that out in there, but so here's a good way to conceptualize it. Every living organism has an environment. So that child has an environment that is deeply dependent and connected to the mom's environment. It's the amniotic fluid and the sac and the membrane. Yeah. Well, how does that kid breathe? Through the through the arterial system and venous system that goes through there. How does it get nutrients? Same way. How does it experience the environment? Mom gets a higher level of cortisol or norepinephrine, and it runs through there. The cortisol runs through there. That kid does have an environment. Now it's getting pathological amounts of cortisol in there. And then, so you are absolutely right. And the way to conceive it or conceptualize it is that every organism has an environment. We think of environment, okay, well, my surroundings. No, it's much broader than that. And you have to, it's sort of like a kaleidoscope. You have to really envision what you are saying and how that impacts the development of the child, the central nervous system, the endocrine system, which we often forget about. And you're absolutely right.
Yeah. And, so now we're looking at like the history, we're looking at a timeline, we're starting to get a little bit more insight, understanding, awareness of anxiety. It's not just something you experience out of nowhere. There is oftentimes you could trace it back to anxiety producing events that are related to our attachments and how we relate to those attachments. And I also want to talk about, there is something called situational and circumstantial anxiety. We all feel that sometimes when something is at stake, your blood starts to rush a little bit, you start to breathe a little bit more, you start to think a little differently. And those could be certain situations and circumstances that we experience, but they're one-offs, right? It could be a specific acute crisis at work or something with finances or something with housing. But once it resolves, it goes away. The stuff that most people on this channel watch for is not that kind of stuff for the most part. I'm overgeneralizing. But it's the individuals that say, I don't know what it was, man. From the time I was 10 years old, I just had this anxiety. And the best way I can explain anxiety to those who might not know what it feels like, imagine grabbing an invisible blanket and wrapping it around the torso and wrapping it around the body, and you can't see it. But it impacts the way you breathe a little bit, and it impacts the way you feel a little discomfort in settings. Now, the more anxiety you have, the more this blanket's getting tighter and tighter and tighter, to the point that you feel like you can't breathe. For those of you who've unfortunately experienced panic attacks and have experienced that sensation, the impending doom, that feeling of like, oh my God, am I having a heart attack? What's happening to me right now? Like the fear of like, you can't catch your breath. It's like that blanket's just getting tighter and tighter. So what we do is, as human beings, we tend to look for solutions for the symptoms we experience. And sometimes we go to places like doctors for those, or sometimes we self-medicate for those things. And what type of medications are commonly used for this? So benzodiazepines, but I'll keep it with like the more self-diagnosis. Alcohol. Alcohol is probably, in my opinion, the most widely used self-medication for anxiety disorders. And, and there's a psychopharmacology that can prove that benzodiazepines and alcohol, even though they're different structures, one's a pill and one's liquid, very, very similar in what they do and how they impact the body. A lot of adolescents, maybe they don't drink because it's harder to get. There's a smell that comes with it. They'll go into the marijuana route of things. And the marijuana, I've been on record, by the way, for those of you who don't know, I'm in recovery myself from substances. June 13th, 2008 is my sober date, and I've stuck to it since then. But marijuana, when I had serious social anxiety, I'll give you a background of me. I moved here from Iran at the age of 16 years old. I had all these 3,000 kids in school. I felt out of place. I felt like an outcast. I had really bad adolescent acne. I had fear to talk to people. I was really depressed, to be honest with you. At that point in my life, thank God for marijuana at that point in my life, because it helped me cope with feelings of anxiety that I didn't know what to do with. I couldn't talk to my mom and dad. I couldn't talk to my friends about it. Marijuana calmed me down. Now, the problem with self-medication without getting to the underlying roots, and this is what people have experienced before, the problem with it is that eventually what you're using for the solution starts to become the problem because of this thing called tolerance, because of this thing called the need to consume more of the drink or the drug to get the same desired effect, right? So now if you're just a couple shots of alcohol does it for you, half a bottle later and the anxiety is not going away. Not only that, doc, as you've seen this, what happens? The anxiety starts to rebound significantly when the person's not using and enter the world of addiction, drug addiction, alcohol addiction. And, people can also use opiates to self-medicate their anxiety and all the different things that you've seen, doc. So that's kind of, if you've got in that boat of self-medicating, whether it's by prescription medication or alcohol or marijuana for your anxiety, I understand and I have a lot of empathy and compassion for the reason why you're doing it. However, I do hope that even if you think it's working short term, it's doing absolutely nothing for the underlying causes of your anxiety. And guess what? Even if you manage for a little bit, when life gives you a little bit more stressors that really, really impact your attachments, at that point, the solution that you found is not going to work. And that puts people through a very, very challenging and difficult time, because that's when the life starts to unravel. And that's what I've seen personally and professionally from a lot of people.
Yeah, I want to add to a little bit to that and get your feedback. You described kind of the classic symptoms of anxiety, and it's insidious and it's yucky, right? And it's painful. But my suspicion is, and from what I've seen, it's ubiquitous, and the prevalence is a lot more than, well, we're certainly not treating everyone with anxiety disorders. I think one statistic I read is we're treating less than half of them. But, you brought up something. Tell me what you think of this. My suspicion from what I've seen is many people, and because the mental health disorder is also cultural and social, has cultural and social ties, many people might go many, many years and even a lifetime not recognizing that they have anxiety in a debilitating way. First, what are your thoughts on that?
That people didn't know they have anxiety?
There are people that will go many, many years, potentially a lifetime, especially, let's say, of me and your culture, right? Some man, right? He's not going to go to a doctor. But even here in the United States, in the West, I suspect, because, I've noticed, at least for me, when I have it, it's subtle, right? And it's this sense of, I have to almost stop myself. My muscles are tense, right? My neck is tense, and I'm hyper vigilant. Maybe my heart rate's a little bit increased. My blood pressure usually doesn't go, but then I have to step back and say to myself, wait, what are you doing here? This is your perception of the world. This is your perception of what's potentially going to happen. It's an underlying thing that you're trying to turn into fear, but it's more subtle than fear, right? Because fear and anxiety, in fact, it's interesting because Freud made that distinction, but he didn't care too much about it. Fear, we can talk about an external object and a threat, and I have radical response and reaction. Anxiety is much more subtle than that, although it's related to it. Sometimes you can't pinpoint what it is that's eating you up. And that's when you have to step back and reach into the toolbox. And unfortunately, for so many years, it's been, you're right, by the way, alcohol is the primary source. Marijuana is another one. And then eventually doctors were giving benzos for unlimited amounts of time. And now we have this situation where I get people in my practice from all over the country. Hey, I've been on Xanax 4 milligrams for 15 years. I got to I'm ripping myself off of it and I feel horrible. Well, okay, we're working with something new. But I think you hit it there. People really self-medicate with alcohol. And what do you think about what I said? Oftentimes people will go and it's so subtle. It has to be pointed out to them. Look, you got severe anxiety here. Let's start addressing this.
I agree wholeheartedly, and I'll tell you why. So, first of all, we don't know what we don't know. right? That's like as simple as it is. For human beings, you don't know what you don't know. So when you're unaware, because awareness is the first step to change. So when you're unaware of what you're experiencing, you just think that's the way it's supposed to be. And that's the way I'm supposed to feel. And there is a distinction. You talked about our background, cultural background, but we've done a video together on toxic masculinity, which I don't think just impacts males, by the way. Toxic masculinity impacts females too, because they need to become a certain way to feel like they need to survive in this world. And the bad traits of the toxic masculinity can get downloaded on females also. But toxic masculinity, I have an example. I coach high school sports. Some of these kids, they say, hey, coach, I'm feeling these things. They're naming off anxiety. I mean, they're naming off anxiety to the T. But they're like, yeah, but my mom and dad say I should just tough it up and man up and just deal with it. You know, it's okay. Life's going to go on. And that little subtle message right there that young people get of just like, hey, it's just a part of life. I think that throws people off, because once you understand what I'm experiencing is anxiety, and then it allows you to start taking some action on how to better manage that. Because here's the thing, we all experience anxiety. Anxiety disorders, I think, are a byproduct of not meeting anxiety head on and allowing it to go on, avoiding it for so long to the point that you can't anymore, you know? And so I agree with that wholeheartedly. And I also want to do this. You talked about fear and anxiety. I understand the human brain is a pretty fascinating thing. And as a child, if you're always having worrisome thoughts that lead to potentially like fearful thoughts, like I was talking about earlier, the brain, you know, it's beautiful and it's fascinating, it's marvelous, but like sometimes it can't distinguish the difference between real and perceived fear. Like when your fight or flight system turns on because the house is chaotic, this and that, your brain is lighting up the same way. Like, hey, I got to save my life here. Like there's a cheetah chasing me, you know, like to that extent that we're talking about the true fight or flight. And people that live in those environments their whole life, their fight or flight has been turned on for so long. Their ability to regulate stress has gotten weaker and weaker and weaker. And sometimes you see someone that like they're experiencing a couple little minor things in life, but they're going through a full-blown panic attack. It's because the system is so weak. And by the way, those individuals who are constantly worried, they also, you nailed it on the head, they have weaker immune systems. They're constantly sick. They experience chronic fatigue. They experience lack of kind of excitement, low passion for life and all that stuff. So when we self-medicate, we're trying to get those too. You're trying to just feel better. It's not just anxiety. You're trying to get energy. Alcohol, as you always say, is the weirdest drug because it starts off, even though it's a depressant, you know, but it starts off as a stimulant. You know, it starts off, it gets you going, it gets you energized. People have a couple drinks before going out. Then it turns into this, you know, this kind of a sedative hypnotic type thing. And then it turns into this depressant type thing. I've watched your video on that. And people are looking for all of that stuff that impacts anxiety. Just as an anxiety it impacts a lot. It impacts a lot of the system, especially at a young age. So I agree with you, man, more than I could say I do. It's just a wonderful way to look at it. And so when people don't know the symptoms, it's that's a problem. That's definitely a problem. And that's what a lot of the people, they go to the doctor and say, doc, I don't know what's going on with me, but this is what I'm feeling. They get the medication for it and that's it. They think it's over, but they never found out why they were feeling that in the first place.
And with that same thought, let me throw something else at you and get your feedback on it. So it is a very complex disease process, but I will also add, not only do they not know the symptoms oftentimes, the comorbidities that are associated and affiliated really start to mix and match and come in. And I'll give you a very extreme example of that. For example, excuse me, in the cluster B group, when you look at true pathological narcissism, a true pathological narcissist, and I'll just leave it at that, I won't define that stuff, is really somebody who's in a heightened state of perpetual constant anxiety and paranoia. And if you were a theoretician, and some have, you can say it can be described as an anxiety state, and they often present to the, you know, the typical clinician's going to miss those kinds of heavy duty personality disorder, and they will present and they will diagnose them with Oh, you have severe anxiety. Oh, you have severe anxiety and depression. Oh, you have some OCD. These things start to get all mixed up. So it almost doesn't matter. It takes time for you. Got to, even for me, right? I'm not a psychologist, but I get a lot of this crap in my office. And I tell them first thing, look, it took a hell of a long time for you to get here. I can't fix this overnight, but we're going to start in a sober minded way addressing stuff. I'm just a dumb doctor. So first I'm going to start with that really messy medication regimen that you have, and let's start addressing that. I'll counsel you as best I can, and it takes a while. So if you can give me some thoughts on what I said about the comorbidities, different presentations, connections to all these other mental health issues, and how they present that way, and it's just this mixed ball of just crap.
I gladly will, because we think alike again one more time. I think that's why we get along so much, because our yeah.
That's why I think you're brilliant, because I'm like, oh, he agrees with me.
You're just complimenting yourself then in that case. All right. So what I see there, when you talk about comorbidity, and earlier on you talked about personality disorders, and when the cluster B you're talking about, for those who don't know, Doc's talking about personality disorders, and narcissism happens to be one of them. So one of the things that goes to that, to go back to the originating talk about today, was it goes back to attachments, and it goes back to oftentimes to abandonment or some type of a serious trauma that happens at that point, which leads to what? Very, very low levels of self-worth, self-esteem, to the point, and what does that do, by the way? Oh man, you're going to be an anxious living life form in this world of 8 billion people if that happens. When that happens to the individual, they start to experience significant amounts of anxiety. And check this out. Some people with that diagnosis can take that anxiety and they call themselves high functioning people with anxiety, right? And they can masquerade and they can hide behind whatever they want to do. But underneath it all, it's all the same. Significant anxiety that's rooting and running through every action they take, everything they do. It's all calculated, all that kind of stuff to protect them and hide from the world that they actually have all that. But it all goes back to attachment. So I do believe that a lot of our diagnosis that we get later on in life does oftentimes get traced back to that. And I've had clients, program participants, patients tell me, I can't really identify that much trauma in my life. My attachments, my mom and dad were okay. This comes up a lot. People say this. They're like, I never got psychologically, physically, sexually abused. Like, I don't know what, my mom and dad were both around. Like, they never got divorced. So they have this challenge of like accepting what I'm talking about here. But one of the people that I really look up to said, trauma isn't always the things that happen to you that shouldn't have happened. Sometimes trauma is the things that should have happened that never happened. Do you have any idea how many wonderful, beautiful providers, like moms and dads that are providers for their family, that put food on the table, that go to work every day, that work, that travel, that grind 60 hours, 70-hour weeks? They're like, dude, I'm doing everything I can. And you know what? I commend them that they are doing everything they can. But to the child, that parent is never around. To the child, that parent has never, they're always like, there's a thing called emotional proximity. Like the parent's just not around emotionally. And like, here's the thing, that parent never abused the kid, but that parent never gave X, Y, and Z that the kid might have needed to be able to feel safe in this world because they were out doing another thing. So sometimes trauma is things that should have happened that never happened. And that's helped a lot of program participants. That's helped a lot of my patients out over the years.
I'm so glad you brought you keep going in topics I want, but I'm worried about these guys. I want you to look at some of these things, guys. I don't have my glasses on. I'm trying to do
There's so many comments, Doc. I can try my best. There's just so many.
But I've repeated what you just said many, many times as well. And I'm going to give a little story. I want people, trauma is sort of a buzzword in our world now, in the substance abuse and mental health. And I like most things nowadays, look, it's not just taking some kid and abusing him verbally, physically. Look, raising a child needs an incredible amount of subtlety, emotional in-tuneness, and awareness. I had a psychologist that I really respect recently tell me a little story, and she went to a professional women's meeting just to see what they're talking about. And it might have been in the law world, right? And I think they were talking about career versus family. And she just kind of barged in and was listening to this stuff. And somebody on the panel was talking about, they were talking about, well, we have to choose family, we have to choose work, whatever. One of the panelists said, well, when I got to go at night, I just tell my kid, hey, I have something more important to do. And she was telling me how the hair on her back stood up when she heard this professional say this. Imagine you have a 3-year-old who's still going through separation, individuation. That object is the most important object in their life. That object nourishes them emotionally, psychologically, physically, safety-wise, anything you can imagine. And now that object turns to you and says, I gotta go, honey. I love you, but I have something more important to do. It horrified me. And so when you get these kids that are like, well, I can't really remember anything, that's what you don't remember. And I mean that, right? I'm off the cuff here, but I really mean that. And I think that describes what you were saying. It's not just things done to you, it's things not provided for you. And I want to add one more thing, a little bit from my own personal experience. And, in life, it's a learning thing. Look, for all of you that have children out there, I don't give a shit what age your kid is, 2, 3, 4, 5, 6, 7, 8, 9, 10. I feel strongly about this. And when you're with that child, disconnect from the world. Everything has to go. You have a categorical duty to plug in, even if you try not to pretend. And sometimes when that kid is playing, they just want you to be not just there. Don't just be there talking on the phone. Don't be there looking at your text. Don't be there looking at the TV. Don't be there writing. If you took the responsibility to have that child, engage. And do it the next day. And do it the next day. And do it the next week. And do it the next year. And do it until they are safe out there in the world where they know the source of emotional support and comfort, the source of psychological support and comfort, and to some extent, maybe financial and other resources if you can, and that's whatever it is back home to you. And in that way, it's boring. It's a life commitment now, but that's the situation you're in. And that's how you will evade and mitigate substance abuse, a lot of mental health issues, and a lot of the other autoimmune diseases, pulmonary diseases, legal issues. I'm telling you, good stuff in this world is hard work and it's boring at times. But find joy and pride and pat yourself in the back and give yourself grace for the fact that you stand up and do this every day. I just you brought that to my mind.
Yeah, thank you. I mean, that's a very powerful message to all humanity. I think, Doc, it's whatever you do in life to be as present as you possibly can be.
Yeah, it's whatever you do, be present.
Yeah, and when you're dealing with a human being that you are their whole world. I mean, I don't know if parents know this or not, but up until the age of probably 11 years old, when the child starts to see themselves a little bit different, differentiate themselves from their primary caregivers, and that's when like their friends become their life, and it's like, Mom, Dad, leave me alone. Like, I'm with my friends. Like, there's a little shift that happens there. Before that, you are their world. I mean, I wouldn't go as far as saying you're their God, but you're pretty much their everything. And in that moment, this becomes really important. And someone wrote in the comments, like, I wonder how humanity made it this far. And I'll tell you this. There's a lot of parents who they themselves did not have parents that did for them what Dr. B is recommending and suggesting. So I get that. I understand that you are a human being. Your parents didn't have the knowledge, the education, the love, the support, the ability to love you the way the Doc's saying it right now. And as a byproduct of that impacted you. It impacted you on a psychological, emotional, physical, immunity, everything. It impacted you like all together. And now you're in this part of your life, and maybe you have a child of your own. And here's the thing: until we know better, we don't know any better. But once you know better, once you get exposed to what Dr. B just said right now, and you know better, we are actually required to do better. See, I always say that hurt people, right? Hurt people. And it just happens automatically. And that's how there's multi-generational patterns of trauma. That's how there's multi-generational patterns of pain. That's how things like addiction and mental illnesses get passed down from generation to generation. Man, that thing's not I mean, I'm not going to go completely say it's not genetics, but the environment is what's getting passed down, my friends. The environment's getting passed down, the cold, the distance, the emotional proximity that he's talking about. But once you know better, and that's when it's like, okay, who is going to be the one that's going to break this pattern in my family's life? Who is going to be the one that's going to show this innocent being what love looks like, feels like, allow them to experience it? Because if it's not you, then who? Do you really think that the school system is going to do it? Do you really think that the social peer groups are going to do it? Do you really think that our society that just wants all of us to be sick and wanting and yearning for more and things that we don't have is going to do it? It starts with the individual, and it starts with the family, and it starts from that simple relationship between parent and child. And if you heal that simple relationship, you start to heal the child and how they experience the world. I'm going to go even further than that, and you're going to start to heal societal impact that your child is going to have with others. And I'm a dreamer. I'm a hoper. I'm a dreamer. That's why I do this. That's why I dedicated my whole life to this. That's how you change the world. And I'm not naive enough to say you're ending hunger in Africa by doing that. I get that. But you're changing the world for your loved one, which is changing the world because it's changing the world for that person. And if I don't believe in this kind of stuff wholeheartedly, I wouldn't be here with you on this live stream. I wouldn't dedicate every minute of my life to talking about people about this kind of stuff. So thank you for saying that and really reinforcing that message of how transformation and change happens. It starts with a one-to-one person communication, one person impacting the other and being fully present for them. The way me and you are present for this live stream right now. We're giving all we got right now. And that's why people connect to this. That's why people feel something about this. And I know they do. I mean, I've done this with you long enough, and I see the comments. This means something to people. And it means something to a child, too. It means a lot to a child, too.
Yeah, you're absolutely right. You talked about at the age of 11 when they go out and, engage in the world and start saying, Mommy, leave me alone. Daddy, leave me alone. Here's one thing. And I think, and I'm getting deep into the sinews of the mechanics of psychodynamics, and I could be wrong. What happens when they go out there, if you've nourished them properly, where they feel safe with you and they feel this is my safety zone in every area, emotional, psychological, what you've done is you've facilitated healthy formation of that child's ego self.
Yeah.
And now he has the tool, and I don't want to get into what that generally means, but let's take it tongue in cheek. Now, when he goes out there and some kid is doing something they shouldn't be doing, smoking a joint at 11 years old or watching pornography, I don't know, whatever it is. By you being there all that time, you can, for the most part, of course, different things happen. Rest assured that that child is going to have the strength in his ego to walk away from that and say, I don't even need you to approve me. I got approval at home. He's not thinking that, but that approval at home leads to healthy formation of the ego. It's not fractured. It places that child correctly in his world of development and the narrative of his life history. And he walks away from most of those things, hopefully unharmed and with experience. That's what I believe is happening down in the details of this stuff, even if the individual is not realizing it. Think about it. When a guy's going out, smoking a joint or doing drugs with, whatever, at the high school party, he's looking for approval.
Yeah.
Well, yes, there's a natural part of that in those developmental years, but it doesn't mean you should be slamming heroin, right? So something's wrong if you take that extra step. There's nowhere to go to safety-wise at home at some level or another. It might be mild, and I'm putting words on events, but I think that's what's happening, Parham.
Oh man, it's spot on, Doc. I mean, we just keep agreeing with each other, but that is what's happening. And the stronger the attachments are, which leads to a healthy ego and a healthy sense of self. It comes from the attachments again. And by the way, for those of you who think that it needs two attachments oftentimes potentially could help more, but one strong attachment, as long as we can attach to someone that we know unconditionally loves us, and even if we go out in the world and make mistakes and we come back and we feel safe enough to be able to talk about that mistake and work through that mistake and not be fearful of, like, what if I tell my mom or dad, are they going to not love me? Are they going to get mad at me? Are they going to shun me? You know, all that kind of stuff. If the message is like, no, it's okay, that person starts to learn through their mistakes, healthy brain development, healthy life experiences. And that's the beauty of it all. And I'm telling you, this can be done. I mean, people might think that what we're saying is like really, really out there. It really isn't. It's very simple, actually. It just sits from sitting down, one person to another, and just being physically present. That creates safety, man. It creates like a sense of like, I'm okay in this world. You know how many people, by the way, you've heard this, they say, I just feel so alone in this world. You know, it's like a common thing that as clinicians we hear. Well, the world's got 8 billion people in it. The odds of feeling alone when there's 8 billion people around should be slim to none. But it's a psychological state that we get. It's this emotional state that we get, that we can't attach to anything, because previously we've attached to things and gotten hurt. We've attached to people and gotten hurt. We attach to ideas and our expectations let us down. So we're terrified of attaching. What if we were attaching to the wrong things? What if we never learned how to truly attach? What if the world of 8 billion people can actually be a safe place that you never have to feel alone? I mean, that's a different version of the narrative.
So Parham, you're opening a can of worms, and we need to go into this issue, because we've talked about anxiety, and then one natural progression from this discussion is connectedness, right? The opposite of substance abuse. I've said it before on my social, the opposite of anxiety, and I'm going to avoid going there. And the time flew by so fast. You might have to commit one more day to me, but is it possible we look through? I feel horrible because I want to respond to people's things. There's so many wonderful comments. Everybody out there, thank you for the support you're giving us. I'm trying to see as much as I can, and I'm going to go back and read every one of these. But Parham, could we put a couple of?
Yeah, I'll read one right here. I can't, to everyone, there's no way I can go all the way to the top of this. There's like probably a couple hundred messages here, but here's one because we talked about ACEs. So someone said, I neither had my mom or father present. I have a really high ACEs score, which is adverse childhood experience. So this person experienced a lot of pain and trauma in their life. That's why the high score is. No sense of safety, and loneliness is killing me. So as a byproduct of their childhood and a byproduct of their high ACEs scores and all that stuff, they're feeling kind of what we're saying. And they're at home listening to us. So there's something called protective factors, and there's something called ways that we can start to heal from this. So some of the most important elements here that I would recommend as a clinician is to get into true trauma therapy, not just a buzzword as someone says they offer trauma therapy, people that assess you through the ACEs lens, and people who can provide therapy, specific therapeutic modalities that help with healing some of that underlying trauma. Because until you heal that underlying trauma, you're always going to feel not safe in the world. You're always going to feel lonely in the world. And guess what? I hope it's not your case, but you're going to keep recreating and perpetuating the same cycle over and over again. And therefore, you're like, nothing's changing in my life. So finding what means safe to you, finding individuals who are trustworthy individuals can be found, right? Oftentimes they might come off in a professional sense, in a professional setting, but you start to practice the ability to be able to trust. And then it gets into self-care. So here's the thing, no mother, no father present. You can actually mother yourself and father yourself in specific things, in specific moments, in specific times in life. You know what's good for you right now. You're an adult. You're not a child. You know that instead of sitting on the couch, walking around the block and getting your body moving and getting some sun shining against your face and drinking some water will make you feel better. Now it's a matter, if your mom and dad never told you to do it, will you start to tell yourself to do those things? Because it takes slow incremental changes to make monumental changes when it comes to trauma. And I don't want you to think that's a death sentence. There are many people, I want you to hear this, that no mother or no father present in their life, that had high ACE scores, that have been able to not overcome that. I've seen them stand in front of rooms with 200, 500,000 people speak their story, and they speak in a way that all of your hair will raise on your skin, and you'll be so motivated to go do something with your life after it because they show you transformation. So it's possible for you, my friend. KM, whoever you are, it's possible.
Okay, thank you for giving us that, and it brings up something that I think, Parham, I want to throw this at you, and this is the way today went, but I want to get close to the end by throwing this at you. You brought this up. I think me and Parham are in the same boat. So far, we've talked about pathology and crap, but on the other side of this, and that's why Parham does this and has committed his life to it. On the other side of this, number one, I think we both agree on this. Although we are a big proponent and I think we both have deep understandings of the developmental issues that have gone awry and how you have come to your current life circumstances, we in no way dismiss anyone of responsibility and accountability for their lives. And I think Parham's going to agree with me on that. It is what it is. To be human and to have the central nervous system that we have is mysterious and magical. And understanding that and how it works in its environment, we do not relieve you of the responsibility for yourself. And two, there is absolutely hope for everybody, no matter where you are. It takes time. It takes work. Parham, can you give me feedback? And one more feedback, give me, how do you find a good trauma therapist for people out there? And those three thoughts.
Yeah, so the part that everything can, the responsibility part, let's start from that one. So I want to distinguish something because I've actually ruffled a few feathers here when I've told people that they're responsible for their circumstances they're in right now, because they'll oftentimes go into a very true and painful experience that they've had and say, well, I've experienced this. How are you telling me that I'm responsible for it? Because they're mixing something up. I never said that it's your fault. So there's a difference between fault and responsibility. You know, I'll never tell a human being that experienced pain, trauma, abuse by someone else that was their fault. I would never do that. And I never have in my life. But as an adult who's gone through that experience, I will tell you, as painful as it was and as much negative impact as it had on you, that you are responsible, and it could be with the help of others, but you are responsible for healing from the negative consequences and side effects of that experience.
That's what I was referring to, just so you know.
Oh, I know you are. Yeah. Okay, yeah. I throw fault in. I know that's exactly what you're saying. Yeah. So, and sometimes people say, well, I don't want to take responsibility for the fact that this person did this, this, and this for me. Well, you know what? There's no other option. That's the part that people think. It's like, okay, well, if you don't want to do that, that's cool. So you can sit in the pain and trauma and agony and the discomfort and the continuous cycle you have and probably recreate it with another person that's going to do the same thing to you. Or you can say, you know what? I just got a really bad cards dealt to me, and it was a painful experience, but I'm going to take responsibility for my healing, not for the impact, but for the healing. And that's how the multi-generational patterns get broken, by the way. When someone finally says, I'm responsible for my life, I'm responsible for my healing. And in order to find that, I mean, psychology today, believe it or not, does have some resources that you can go use the filters and use your insurance panels and use the different people that special modalities in your area. And you want to go search it specifically for trauma. So you want to go find trauma therapists. And just like any other profession, I want you to know that therapists offer consultations and you can ask them questions about your specific situation. If you feel the person is competent, they know what they're talking about, they have some good references about the work they've done, you know, it's probably a safe person to give it a try with. But if the person just saying they do trauma work because it's a buzzword, and, you know, people just say it's trauma, but they don't have the expertise. So sometimes there's trial and error with therapists to find the right one. I want you to know that. It's not like you try it once and it didn't work and you say therapy is not for me. That's not really trying. You know, it's actually trying to find the right person. Is there a cost associated to this? Oftentimes, yes. There are sliding scales available that you can ask your therapist about. There are even good universities and institutes that the students there are under very, very professional supervision that often, you know, provide counseling services in their colleges and their universities that you can access, at least to get the wheel going. And I'm not saying you got to dive into all your trauma with the first therapist. Work on some stuff. Just get the psychological, emotional muscles of like talk therapy going, because it does work. You know, there was someone up here that wrote something about their child that I want to bring up, because it was a important thing for some family members to understand. So someone said that therapy for their son helped. No drugs. I would not allow that because my own addiction. He is now in the 4th year of college, and I'm amazed. So sometimes family members, when they have a child that's acting out or experiencing mental health illnesses, they say, hey, we want you to go to therapy. We want you to go to therapy. In that moment, if that's just sprung on the kid starts to think something's wrong with me and nothing's wrong with them. I want you guys to know that. That's just what happens. I'm broken and nobody else is. So sometimes as a parent and as adults, it's okay to model that it's okay to go to therapy. And I'm not saying if you don't have issues and stuff like that, you don't have to go every week. Maybe you just go once every 2 weeks and just do a checkup for your neck up, just to get some awareness about where you are in life. Because if you go to therapy, you're modeling what you would want other people to do. And that's something that I think is really important for parenting to know. Does that make sense, Doc?
Yeah, that was awesome.
Yeah.
I like that. Check up for your neck up.
Yeah.
And I love what you said, it's not even taking a fall. And, somebody else said to me, everyone goes to checkups for their body, but what about your mental health checkups?
Yeah.
And I like that very, very much, Parham. We're getting to out of town. Unfortunately, I have engagements today in Los Angeles. And I feel horrible. This was such a fantastic show. The showing was great. And I wanted us to go through this stuff. So Parham, I think you're basically plugged into coming back. Give us some word of hope for the future for everyone. This stuff is all over. It's not a joke. It's heavy. I deal with it. You deal with it. We do the best we can. Give us some parting thoughts, and then I'll close with reeling you into a future date where we can continue this with all these folks.
Well, I'll do the last part. You can count me in for a future date. Maybe instead of weekly, we do bi-weekly. I could commit to that.
Yeah.
I can commit to bi-weekly.
We'll figure something out. Yeah. But I just, and I'll put 2 hours because we were just getting into this. And again, all the support out there, the love out there, and I feel bad not being able to address people's things. Guys, just so you guys know, we try to address. I get hundreds, if not thousands, of messages. I can't, and I read as many as I can. Sometimes I don't even have time to text back. So I'm sorry, I'm not neglecting anybody. It is reality. I do what I can. But please, Parham, give us some thoughts, wisdom, parting words, a little bit of love, whatever you want.
Someone wrote something nice about us. I just want to acknowledge us. Blue Moon wrote, I don't trust anyone in the med field anymore, but seeing you two literally made my heart skip a beat because you care genuinely. And I'm glad, and if it gives anyone any hope, I'm someone that experienced debilitating anxiety in a significant, challenging years of my life, adolescent, formative, childhood, really anxiety, which led to substance abuse and just messing my life around. And everyone's story is different. My life isn't yours, but the message that I have, the takeaway for everyone, that life can and will get better if you allow yourself to heal, right? What we always do, we always want to say we're broken and it's never going to get better and it's never going to be, I've tried this, it doesn't work. We just come up with all these limitations on ourselves, and those limitations never allow us to break through and get to that transformation process. And hopefully us coming back here, talking, being a part of this community again, and kind of providing that support allows you to see the possibility of human transformation that exists in you and your life. Do what we can. And Doc, with your permission, I'll go into the comments here and I'll write back, because we didn't respond to anybody really. The ones that are related to my, they're talking about, the things that
you're completely welcome to do that. I see some that a lot of people at Randy, I see her up there. Blue Moon, I know Blue Moon.
Yeah, some of these people, the medical stuff, obviously, just so everyone knows, I'm not a medical doctor. So if you have questions about medications, I will not even engage with you.
Feel free, do whatever.
But the mental health stuff, I could do that on my part. And it was really good to be a part of this community, Doc. Thank you for the opportunity again. And thank you for everyone for your participation.
Yeah, thank you. So what do I do? Do I just, by the way, on the Facebook, TikTok, guys, thank you for joining us. If you are on the channel, give us a little love. Do a like and subscribe, because it really helps the channel grow. And do I just leave the thing, Parham?
Yeah, it says leaves. It says end live stream. You should see something over there.
Do you want? Okay, so you want me to end broadcast, and then you're going to answer some of these questions?
I'll answer these. I'll go on later on and just type.
Okay, and I'll leave mine up so I can do that. So bye, everybody. Thank you so much for coming and joining us. We love your participation, your support, your engagement. I am so sorry. Someone said next time do it 2 hours. We will. See you guys. Bye bye.